Welcome to another episode of Your City. This is the show where we let you know how your tax dollars are being put to use in the city of Billings. Today, we are joined by Police Chief Rich St. John, and in a little bit, we'll be joined by the Fire Chief, Pepper Valdez. We are talking today about the Public Safety Mill Levy. Of course, this was a $7.1 million mill levy that the voters approved this November, and it will provide a lot of benefits to the city. And I know this is a big deal, Police Chief Rich St. John. What do you have to say about that?
Well, first of all, I'm very thankful and appreciative of the community's support of public safety in general. I think that they spoke loud and clear. I was always cautiously optimistic, but it was a significant victory in that area, more than I thought. And so that speaks volumes as to the support that public safety has, and specifically the police department, the trust that citizens have in our ability to get a handle on some of our problems.
Right, and this was something that the voters actually approved 2 years in a row, right? Talk to us about the difference of 2020 versus 2021.
Yeah, certainly. So prior to 2020, the city was moving full speed ahead to make significant investments in public safety. And to the tune of, for the police department, it was 30 officers over 5 years, which is extremely expensive. Obviously, there are other components to that. Pandemic hits, we get into times of economic uncertainty, and so the decision was made, rightly so, by the council to just ask the voters for enough money to remain status quo. We had always said that we will be back, we just didn't know when. And so when 2020 concludes, we have record numbers, double-digit numbers in violent crime. And I'd always made the comment, if not now, when. So the difference between that one and this one is 2020 filled a hole. We were $4 million deficit in the public safety fund, and had citizens not voted for that, we would have been forced to make layoffs and reduce services. Thankfully, that didn't happen. We didn't add any service. We didn't add any additional personnel. We just remain status quo. 2021 comes around, and we want to make improvements to the criminal justice system. The thing that was different about this, it was a holistic approach. It really wasn't just about throwing more police officers on the street and expecting a different outcome. So we approached it from a holistic standpoint. We brought our city attorneys in because they help out on the back end. Code enforcement takes care of issues on private property where we can't. And of course, our partners at the fire department, 99% of the time where we go, they go on a lot of the calls. So we are intrinsically linked. And so I think the holistic approach, coupled with the efficiency and effectiveness study that we had done from a peer group, really gave credibility to our ask. And as I said, fortunately it passed, and now the real work begins.
Okay, so what can the residents out there expect to see, and what is the timeline for this?
Well, certainly this is no panacea. It took many, many years for us to get here, and it would be unrealistic to think that we would just be able to drive numbers down in a year or two. So again, it's a systemic approach for us. We're identifying the problems. Our strategies are to identify the problematic individuals, problematic areas, and attack those. And we know that that works. We have a finite level of new people for the police department. Although we were the biggest ask of all public safety, half of the individuals that we get are civilians. And again, it's under the pretense that we need to be efficient and effective with what we have, and that just throwing a bunch of badges at it is not going to help. It will help. I'd certainly take 28 police officers, but that's not what the council wanted, and certainly the public was supportive of the model that we put forth. So, again, we're going to address those strategic areas, violent crime being number one, our perception of safety downtown, traffic, and then our working with our partners with mental illness, co-occurring addiction issues, which really spill into primarily the downtown area, but we've seen it citywide.
Okay, so how many officers are we looking at, and how many of those are civilian?
So the total number was 28 FTEs or full-time employees. 50% or 14 would be civilian positions, several different tasking that we will have them. And in general, the other half would be sworn officers. Some of those will go to patrol, some of those will go to detectives, some of those will go to specialized positions and supervisory positions, because part of our problem that our organizational structure was out of whack and costing us efficiency issues. So again, I can't stress enough, and a lot of people thought when this passed that there would be a sea of blue hitting the streets, and that's just not the case. We will see increases in our staffing, but not the numbers. So again, we're going to focus on reduction, getting people diverted out of the criminal justice system, and having our officers have the ability to be more proactive. And that's why we're going to lean hard on civilians.
Okay, and how does you mentioned the mental health and the substance abuse, how does that play into this?
Well, a great majority of the people that we deal with and the calls that are generated are that population. Specifically in a downtown area, you have co-occurring mental health issues and addiction. And so it translates into the behavior problems, homelessness, the aggressive panhandling, and it just creates an overall perception in some people's mind, real safety issues in others that we need to deal with. Those people do not belong in jail. They do not belong in the jail, or I'm sorry, at the ER. So what we're doing is working with our partners to divert them out of either one of those systems, which will free up resources, free up funding, and get them clean and sober housing, get them sustainable jobs, get them support, the counseling and stuff that they need so any treatment sticks. And if we can get that done, then that's going to help us on the back end as well as the fire department.
Okay, and the funds are being used to work with organizations that exist already?
Yes, absolutely. It's a small amount of money of the overall ask. It was about 1 or 2 mills at $400,000. We are not in the mental health business. The city of Billings isn't, the police department isn't, but when you look to these issues, we have become the Swiss Army knife for all things social. We're working on things to divert that out, and I think when you ask the fire chief, you'll talk about his priority dispatching, which will certainly match up the right resource with the particular incidents you have. Right now, it's one size fits all. You get a police car, a fire truck, and an ambulance, and that is not efficient. And we have identified over the last year 90 individuals downtown that have, we call them super users, have cost this community across the board, public safety in the private sector, $10 million of unrecoverable funds. So if we can even cut that in half for the $5 million, then that would have taken care of our, our deficit. We probably weren't having the discussion with our citizens. So a lot of work to be done. Thankful that we're going in the right direction. We're adding resources, not taking them away, but certainly realize the great challenges.
Right. That's a significant amount of money for just 90 folks in the downtown area, kind of in the city. So it's nice to hear how this money is being put to use and the taxpayers can know what they can expect to see coming up in the year forward and the years ahead after that. Like you said, the solution isn't going to be overnight, but definitely you're putting systems into place. Talk to us a little bit about the crime rates that you were mentioning. How did those get to be where they were?
Well, it's very complicated. The obvious thing is that Billings is growing. We are the largest city in Montana, the only urban center in a rural state. We have east-west, north-south interstates nearby. So we have a lot of people coming here. We also have a lot of services. Common sense would dictate that the more people we have, the more problems you're going to have. And we do. We have big city issues. The other thing with that is that some changes in laws that took place going back to 2017 have really caused problems for Billings in particular, but other cities in general, on enforcement efforts that we can take, on how we manage parolees, probationers, and those on conditional release. And so we, compound that with COVID over the last couple of years. The justice system was essentially shut down for a while. We have criminals that are extremely emboldened. They're defiant, and we're seeing time and time again they are extremely violent. And so that is a number that we need to get turned the other way. A tremendous amount of domestic abuse is taking place. And unless an officer is standing in one's living room to prevent that, it's pretty hard on the front end. However, with the safety levy, adding additional victim witness advocates, additional prosecutors, additional judges, we can get people charged and held accountable for that, and hopefully turn the numbers down on the back end with that. And so, that's part of it. Homicides, of course, 400% increase, totally unacceptable. The one thing about that is that everybody knows each other. We don't have random acts of violence to speak of. There's a handful, but all the homicides almost unequivocally are related to methamphetamine. Now fentanyl, that's the common denominator. Drug deal gone bad, trying to rip somebody off, things like that. We had a couple domestics. But those are things that, if we can get intervention on the front end, because a lot of these people have been in the system a long time. And the question I get asked by officers and citizens is, why is this person still here? And this is what we're working very, very hard with our partners, state, county, federal, and our legislators, to try to, identify, clearly understand what the problems are, clearly let our legislators know that decisions made in Helena can and have adversely affected Billings. And so we're trying to work with them on some solutions at that level. So a lot going on, more than just putting an officer in a patrol car. And, so we're trying to address it again, as I said, holistically.
Yeah. All right. Well, is there anything else that you'd like to add?
No.
Okay. Well, I think this is really fascinating information for our viewers and for the taxpayers to just know how the money is being put to use. So thank you so much.
Thank you.
Yep. And we're here with Fire Chief Pepper Valdez. It's so great to have you on the show. So talk to us a little bit about the Public Safety Mill Levy passing. What will we see as far as the fire department goes? What will the citizens see, and what's the timeline?
Absolutely. First of all, thanks for having us. I certainly appreciate it. What they'll see from the fire department right off the bat, if I can get into a little bit of detail, what we need to do first thing as of yesterday is get an assistant chief of EMS put in place, emergency medical services. So this chief will oversee an entirely newly created division within our department. And then once this chief is in place, we'll start to put together a committee to determine the details of what that division looks like, set the parameters for the expectations of the new employees that will help us run that division, and then start the recruiting process. That recruit process will probably start in about February, and then we hope to have everyone onboarded about May, June, and get the 12-week training process started, because they will be dual role. They'll be expected to do the EMS portion of it and firefighting piece. So there's about 12 weeks of training there. And then we have some other key positions that need to be filled that was a part of the levy ask, and that is Deputy Fire Marshal. That's been specially assigned for the last few years, but now we can finally fill that permanently. And then a logistics officer. Logistics officer is basically like a quartermaster that can handle oversight of all of our inventory. And then lastly, the final piece, but not the least, would be a fire protection engineer that we want to bring into the department. This individual will be responsible for plans reviews for fire suppression systems in your larger commercial properties, like your Costco's, your Home Depots, those type of large buildings. So we're very excited to have someone like that on board. This is something the Billings Fire Department nor the state of Montana has seen within the fire service. So that's kind of the timeline. We're looking at, as far as the mobile response team, the implementation of that, we're looking around the July, August timeframe to get that up and going. What the citizens can expect from that is roughly a 10% to 25% reduction on how many times those large fire trucks have to go out on medical calls. Medical calls are about 60% of what we do. That's about 6% of our workload. So what we have found over the years is it has been increasingly difficult to maintain those large pieces of equipment going on what we call low acuity type calls. So your tummy aches and stub toes, your non-life threatening calls, sending the big rig fire truck is just not feasible and is unsustainable. So that's why we're going to these smaller units. So less wear and tear and less fuel usage is what the citizens will see, and just becoming more efficient.
Okay, so the smaller actual vehicles, is that what you're saying? Okay, so what will they be?
So what we are anticipating, we have looked at 3/4 ton pickup to a smaller Intercept or a small SUV type vehicle, or even a smaller box type van, like an ambulance, if you will, to respond. So lightweight, less fuel, 2-person teams that are roving. They won't be assigned to a station for a quicker response. We'll have one in the Midtown to West End, and we'll have one in downtown and covering the Heights also.
Okay, all right, so something new that we'll all see out there on the streets. Okay, so talk to us more about the EMS, the program, the division. What else will folks see?
So what they'll see out of that is these individuals will be, like I said, they'll be dual role. But the main focus for this particular division is EMS, obviously. But they will be capable of fire suppression, rescues, hazardous materials mitigations, everything that our crews on the bigger rigs can do. Yeah.
Okay, but just more efficient.
Yes.
Okay. Okay, very good. And talk to us a little bit more about the crews that we'll see going out to the large businesses, the commercial businesses. Is this all about prevention?
Absolutely. So what a lot of people don't know is that, yes, thank you, we are in the prevention business. In our prevention division, they do code enforcement as it pertains to the fire service. They do public education. They do business inspections and licensing, plans reviews for new developments coming into town, and of course, arson investigation. This new individual will be responsible for community risk reduction and the inspections of properties. This is the deputy fire marshal, by the way. And so they will go out to the larger properties, high rises, hospitals, schools, making sure that they're in compliance, and then bringing intel back to us so that we can prepare should an incident happen in any of these buildings. So again, efficiency, that's what we're all about. The other position that goes into the Prevention Bureau would be the fire protection engineer. That's the individual that receives plans from commercial properties that are in development, make sure that they're in compliance, and then also, if should an issue arise, they can be on site right away to come to a resolution for greater customer satisfaction, essentially.
Okay. Okay, very good. Now, we also heard from Police Chief Rich St. John. He was talking about some of the statistics, sort of how we've seen violent crimes increase over the years and how the pandemic had a role on that as well. Have we seen any of this in the fire department? What are some of the things that you have noticed that have just necessitated all of these changes?
Absolutely. So what we have seen, what was interesting is in 2020, right after the shutdown, April and May, we actually saw a dip in our call volume. We are used to running about 60 calls a day. We actually saw as low as 19 calls in a day. And we attributed that to folks just staying in the home and being safe. The weird thing about that is structure fires and those types of incidences, small fires in the home, kitchen fires, increased because people are home more. So our call volume continued to rise. It just shifted or reallocated, if you will. Then it got back on track to what we would consider normal, about the May-June timeframe during 2020. And we also started to see an uptick in mental health, illness, drug addiction, and homelessness. It was already trending upward, but the pandemic just kind of pushed everybody over the hill, if you will, or over the cliff. And so we've seen an increase in that. And so for us to remain relevant in this community, we have to be dynamic and fluid and change with society's demands. So a couple other things that we're looking at in the future is we're working with Substance Abuse Connect and a couple of other programs within the county to develop teams to respond to these particular type calls. Also, we're looking at community paramedicine to have individuals go check up on people in their homes, give them their medications, take their blood pressure, make sure that they're doing their follow-up appointments, and that keeps pressure off of the hospitals also. And then another thing that we're looking at is outside of the mobile crisis team, which was the first one I talked about, we're also looking at a CARES unit to respond with what we consider super users. So those are the individuals that use the system quite a bit. They call 911. I believe the category is 4 times within a year. But we have about 93 that we've identified in our community, and that rate's higher. They're averaging around 15 times a year. So we'll just try to get in front of that. And what we can do in that system is pair a paramedic with a mental health professional to respond to those types of calls also. So again, it's all about efficiency and trying to keep up with society's demands and just be better stewards with the community's or the taxpayers' money.
Right. So a lot of efficiency, a lot of dollars being put towards prevention. It sounds like a great plan. We want to thank you so much for sharing with us. Is there anything else you'd like to add?
Just would like the community to know thank you very much. We're so grateful for the passing of the levy. This gives us a lot of latitude and flexibility to, again, be more efficient with the taxpayers' money. This is a community problem. It's not just the police and fire and code enforcement. It's all of our problem. So I'm very thankful that the community recognized that and are willing to help us out.
All right. Well, we want to thank you so much for joining us, and thank you for tuning in. This has been another episode of Your City, and we'll see you next time.